I met MaryAnn Black in 2005. I had been working in Duke Hospital and got a new position working with Bill Donnellan as his administrative assistant, staff assistant, actually. And he told me to go around the corner and introduce myself to MaryAnn Black. And she had several projects that she needed some assistance with. And Mr. Donnellan felt that I would be a good fit to help support her with those projects. What I learned working with MaryAnn was the importance of really carefully listening to each individual and their issues and making sure that you understand their history, their point of view, where they are coming from. So that often means just taking some time and listening to all sides of an issue and do so gracefully and take all issues and sides into account when making decisions. It is so important to understand what someone's history is or an organization's history. Often, when people are describing an issue and they're passionate about something, there's a history tied to it. And so, knowing that history, why a community is feeling a certain way because certain things have happened, or understanding a person's history in terms of where they came from, where they were born, the things they like to do, where they lived, their life experiences. It's so important to listen to those carefully, acknowledge them, and that can be so important and crucial to decision making. It is important that people feel that they are heard, and that includes listening to their history. When I first started working with MaryAnn, Duke was perceived as separate buckets, separate pieces. There was the university side, there was the direct patient care side. People didn't see the connection between the two. So when Duke became Duke University Health System, and we began talking about how we all work together and then eventually transitioning to Duke Health, people were able to see that although there are many moving parts to Duke Health, we are all one and we are all working together for the betterment of the community. The Office of Community Relations, which is now the Office of Community Health, stressed the importance of having crucial conversations with the community where they are to talk about how is the best way that Duke and the community can work together, making sure that the community's voice is at the center and the focus of all that we do. We developed the principles of community engagement, which places their community as the experts. So we go to them and say, how can we help with what you need based on their needs? And so from the time that I started with MaryAnn to this present day, we have certainly grown so much in learning how to really listen and respect the voice of the community. MaryAnn valued the voice of the community. And so, in all of the work that we did together, that often meant important meetings, one on one, or with groups of people to really listen and hear what was going on with the community, what their issues were, where the needs were, and how we can help. Marianne always reminded people when we were looking at reports, those aren't just numbers, those are people that we encounter, not just within the health system across Duke Health, but in the community and in our daily lives. And so it's so important that we treat every single person, every single encounter gently and with respect. So that was something that had to be brought to every single project, every single meeting, every single phone call, every single encounter. Her time was split between the state and at Duke. But when Marianne was preparing to go, she knew that she was needed there. She needed to be that voice for the people at the state level and also to kind of help inform the work that we're doing here at Duke. So she was able to balance both and make sure that powerful voice for the community was being heard. Marianne had served so eloquently for Durham for many years as a county commissioner, and she was able to take that experience and the people with her when she went to Raleigh to do that work. MaryAnn Black was an incredible mentor. I was so blessed to be able to work with her for almost 15 years. And it was very important to her that she pour back into people. She said that people had helped her and supported her along the way, and she wanted to be able to do the same thing. So, in those years of being with her, she was an incredible mentor, an incredible guide, always with an encouraging word, and also presenting opportunities, stretch assignments to help you grow. So sometimes those stretch assignments weren't easy, but they were beneficial. And anybody that's had the privilege of being mentored by MaryAnn um, knows what it's like to have that very special relationship. When I first started working with MaryAnn, she told me day two in the office, she said, with me, you can never use the words, I can't. So if I ever came to her with a challenge, I could never start the sentence with, I can't. She said, you can never just disqualify yourself from the situation. MaryAnn stressed the importance of following through with the community when you've made a commitment, either to the community, an individual, an organization. When we're working on issues, sometimes they take a lot of time, a lot of meeting, a lot of processes. And that often involves what MaryAnn called sitting right in the middle. If you take a rubber band and you stretch it and there's tension right there in the middle, and often, and when we're working on projects and resolving issues, it takes some time to work through that tension. And while we're sitting in that tension, it's still very important to stay in touch with people, make sure things are happening. If there's questions in terms of why something isn't happening as quickly as we had hoped, continue to keep people in the loop so people know that you still care and that things matter. And so part of that philosophy was incorporated into the principles of community engagement that were developed with the community. That the community is the expert, and that it's always important to keep everybody involved in the process. Focus on people. MaryAnn was such a people person, very caring, very warm, very loving. And she stressed the importance of taking the time to really listen. And she had such a big heart, a compassionate heart. And that is something that she encouraged everybody to bring to their work. She encouraged the staff to do that, just to have that compassionate heart. The work that we do in our office with the community, we're able to help people often at their most vulnerable points. And that has to be done with compassion and grace. And what we all strive to do is to continue MaryAnn's legacy of compassion and grace in all that we do.